Hi, my name is Desiree LaBeaud, and I'm here to talk to you about my WomenLift Health project, which is GLOW, Gender Leadership for Our World. So I'm a pediatric infectious disease physician. I'm a professor at Stanford University and associate dean of global health there. And I've been working in Kenya on mosquito-borne viruses and pediatric infectious disease for more than 20 years. And about 5 years ago, I co-founded a nonprofit called the Health and Environmental Research Institute Kenya with my long-term research partner, Francis Matuku. I work on climate change and intersections of climate change and health. And I wanted to start by just mentioning the climate crisis and the fact that this is the crisis of our time. Human actions are on track to permanently destabilize the longstanding resilient Earth systems that the human community depends on. And so my leadership project has something to do with climate change. I thought that women and their ideas are truly being left out of the sustainability efforts and leadership in coastal Kenya at this vital time on our planet when we actually need all the best ideas coming forward. Climate change impacts all sectors, but the linkages between climate impacts and sector impacts goes unnoticed and unrecognized. And women's leads are left out of those climate solutions. So I decided to use my project to start a climate change makers cohort of women in Kenya called GLOW, or Gender Leadership for Our World, empowering women, energizing climate solutions. This is the group of incredible women that I have as part of GLOW. It's truly a female changemakers cohort with membership across many different sectors, including health, government, nonprofits, industry, conservation, academia, and community groups. And these women come together and are interested in learning more about sustainability in their sector and are inspired by those values. So what have I done in this project? Well, initially I got the women together in January of 2025. I did a baseline survey about their needs, what they wanted to learn in female leadership and environmental sustainability. We've been meeting monthly for the last year, and I provided some specialized education on climate and training on leadership and supportive peer mentorship. I've also started something called Glowing Stories, which is sharing the inspiring stories of sustainability solutions from this female cohort and putting that on social media using my power and privilege at Stanford to draw further attention to the incredible work these women are doing and what their impact in the sustainability space is. And then just recently, I just got back from Kenya where I led a 3-day women's empowerment workshop on the South Coast. And the GLOW women were part of that. And that was led by my nonprofit, the Health and Environmental Research Institute. So future plans include another follow-up survey to see how we're doing and to mark our progress and make sure that we're still on track to achieve the women's needs in the group. Continued sisterhood and mentorship amongst the group members. I'm gonna do further analysis of the facilitators and barriers for women entering new sectors from our Women Empowerment Workshop and apply that to GLOW. And then continue to look for opportunities for growth and leadership in the climate movement through my nonprofit Harry and other GLOW partners. And then when we all met in December in person, we decided that we would like to embark on some sort of community project together on environmental sustainability and health. And so we're not sure what that's going to be yet in 2026, but we do plan to stay together for the entire next year and see what good can come of it. This project really highlighted some core leadership competencies for me in WomenLift Health. I thought relationship building, there was a lot of relationship building in GLOW. I have created a very strong sisterhood and a buddy system, and this is going to make GLOW sustainable into the future. I've spent a lot of the GLOW time developing the GLOW members' competencies in their own female leadership. I've shared with them all of my WLH learnings. I used that survey to understand where we were starting from so I could start to develop them from exactly where they were and meet them where they are. And then 2026, what I'm hoping to do is no longer lead the monthly conferences, but actually rotate leadership of that conference through the cohort because all these women have incredible things to share about their own competencies and leadership profiles that would really help and build the younger members of our group. And then I think the ecosystem mindset was something else that was highlighted in this project. We've really centered local partners. I've used those glowing stories to amplify GLOW voices. And then we continue to build networks with more women joining GLOW all the time for our further impact. So thank you very much, Asante Sana, and thanks very much to leadership for accepting me into this program. I think GLOW is going to last years after I finish up here at WomenLift Health. Thank you very much.